Welcome.
Welcome.
Welcome to Thrift.
Welcome. We have your thriving tips.
Welcome to Trips to Thrive.
Trips to thrive. I like that. Welcome. Tips to thrive. Hi, this is Steve. I saw Dr. Fabi last week. I really want to see her again. I'm just not really sure if I want her to do my filler. You know, I'm thinking about maybe going to someone else. Can I see her again?
Going to someone else? What's there to not feel comfortable with? She's amazing.
I just want to get, I want to make sure I can trust her. Does that ever happen
Trust
to you?
her?
Does that ever happen to you? Where people want to come in for a second consult? Do you see them?
It is rare, but when it does happen, generally if it's a surgical recommendation that we made, then we will allow them to come back one more time. But it's disclosed upon that visit scheduling that any future subsequent consults or visits will acquire a $250 fee.
So you'll see them again when you won't charge them if it's a surgical type procedure.
Right, but if it's filler or other types of injectables or lasers, then another fee will apply.
Because they'll take too much of your time eventually.
Because it's more time, yes.
Okay, and who sees the patient? Like, does the front desk or coordinator talk to the patient, and do they give any advice to help counsel them?
So generally, if they're calling and they're doubtful, our medical assistants are very well trained and seasoned to be able to generally educate them and get them over that trepidation. It's very rare that they actually come in, but when they do come in, they end up seeing me.
What if they want to see before and after pictures? Do you show them that or someone else?
I generally will go through a couple. Again, I just usually redirect them through social media because I have all my before and after photos housed there. And I make it easy for them to be able to see it on social media because I have them all in one row on social media so they can just slide and glide quickly. But if they do come in, I'll just direct them to my medical assistants.
What if they want to talk to someone who's had a treatment by you?
I can't say that we ever really get to that point, and it's probably because I don't have as surgical of a practice as you do.
All right, so 3 tips on the patient who's not yet signed up with you but wants to see you again. Number 1, I'm going to say is be protective of your time, so be very careful, right? Number 2 is have a front desk person or a medical assistant or a patient coordinator who can show some photos, direct them the photos, maybe answer some questions. For me, I'm going to say number 3 is we're patient advocates. We have other patients available who will talk to these patients to help give them advice and let them know what it's like. Basically testimonials, but live.
And then quick question, how do you compensate or reward those patient advocates?
We don't. Surprisingly, they're like really happy to do it.
Wow, they're raving fans.
That's right, like you have.
Woo!
Thanks for watching, and please hit that like button.
And make sure to click on subscribe so that you can stay most up to date on all things thriving.
Like me?
You need to subscribe.